Members, we now move to the second portfolio, which is health and social care. Again, if a member wishes to ask a supplementary question, they should press the request to speak buttons or put an RTS in the chat function if they're joining us online during the relevant question. And I call question number 1, Maggie Chapman.
Thank you, Presiding Officer. To ask the Scottish Government whether it will provide an update on its work to provide mental health and suicide prevention support to refugees.
Minister Kevin Stewart.
Thank you, Presiding Officer. The Scottish Government works with partners such as Heads of Psychology Scotland and local mental health and psychological therapy services to provide access to mental health and psychological support. Along with a range of practical supports, the best first-line treatment to support refugees is psychological first aid, as not all those who need support require to be seen by a specialist mental health professional. If more specialist help is needed, anyone in Scotland, regardless of their nationality, residence status or length of time they will be in the country, is already entitled to receive mental health, psychological or emergency treatment and can register with a GP practice to receive general medical services at no charge. Support can also be provided through NHS 24. Together with COSLA, Presiding Officer, we recently published our new suicide prevention strategy and action plan. This will address the inequalities that can contribute to suicide and will also ensure we take every opportunity to prevent suicide, supporting people as early as we can. Specifically, we will explore how to further support people with no recourse to public funds, including people seeking asylum and people at risk of or experiencing destitution, to access the services that they need to support their mental health, including where there is a risk of suicide.
Okay, I know the answers are attempting to be helpful, but we're going to have shorter answers if we're going to get in all the questions, including supplementaries. Maggie Chapman.
Thank you. I thank the Minister for that response and the recognition that mental health in Scotland is our responsibility, while refugee and asylum system belongs with the UK Home Office. Is the Minister aware of the Asylum Seeker Memorial Project by Liberty Investigates that seeks to name and remember those in the system who have died, either by completing suicide, in despair, or by the actions of others also severely traumatised? And does he agree that ensuring asylum seekers and refugees have equity of access to mental health services, including specialist provision, is absolutely essential to prevent mental health crises in our communities in the future?
Minister.
I am aware of Liberty Investigates project, and the Scottish Government is very clear, Presiding Officer, that all refugees and people seeking asylum living here can access health services. They are entitled to receive emergency treatment and can register with a GP practice to receive general medical services, including referral to mental health services and treatment for specific conditions. I know that Maggie Chapman has taken a keen interest in Baroness Kennedy's asylum inquiry, and one of the recommendations there was that there should be £5 million of annual funding that the Home Office should provide, and I completely agree with Baroness Kennedy on that front. The UK Government needs to recognise the true cost of the asylum system to our individuals, our communities and our public services, and the Home Office also needs to take its responsibility to safeguard people in its care seriously. It must have systems in place to recognise when someone needs support and processes to enable people to access appropriate services.
Okay, the answers and some of the questions are going to have to be shorter. Brief supplementary, Carol Moch.
Thank you, Deputy Presiding Officer. As dispersal areas for asylum seekers expand to all council areas in Scotland, and given we know the truly terrible impact hotel accommodation has had on mental health of asylum seekers, will the Minister, hopefully in conjunction with the Cabinet Secretary for Housing, explore the community sponsorship scheme run by Reset UK as a means to assume greater control over housing of asylum seekers and thus support improved mental health and well-being, given we know the link between housing and well-being?
Minister.
Thank you, Presiding Officer. I think that the situation that the Home Office has allowed in putting people into hotel accommodation, which is often very unsuitable, is not the right thing to do. And the member can be assured that there will be cooperation right across the government to try and do our level best for these folks. However, I think the key thing in all of this is that we should be in charge of immigration and asylum policy here in order that we can get that right for people right at the very start.
Question 2, Sharon Dowie.
Thank you, Presiding Officer.